right, welcome everyone to our Moving with MS virtual support group. Today we're going to be talking about bad habits, but before we dive into that, first of all, especially if you're brand new to our group, an extra welcome to you. This is something that I've been co-hosting along with MS Views and News for, gosh, probably three years now, quite some time. And I just love partnering with them because it's an opportunity to be able to offer you insights and knowledge of MS specific physical therapy, which is not well known. And I think having these tools and strategies and exercises that we talk about on these support group calls can be instrumental in helping you get stronger, improve your mobility, and make your daily activities feel easier, especially today's topic, which is bad habits. So something I like to do in the beginning is have you post in the questions or the chat box over in the control panel to say hello and let me know where you're tuning in from. And if this is the first time you've ever heard of me, I'm Dr. Gretchen. I'm a physical therapist and a multiple sclerosis certified specialist. And I prioritize helping people with multiple sclerosis walk better and improve your daily activities, your functional activities, and hopefully make living with MS feel a little bit lighter. So I see a few people tuning in already. I see Terry says hi from Michigan, Deb from Florida, welcome Deb, Dion from New Jersey, Kathy from Arizona, Julie says good afternoon, it's 70 degrees in California. Wow, that's nice. It is. It's chilly here near Buffalo, New York. All right, keep posting in the comments to let me know where you're tuning in from. And I have a few opportunities for you to post in the chat as well throughout. But let's go ahead and dive in. Excuse me, as I mentioned, I partner with MS Views and News to bring you this virtual support group, and it wouldn't be possible without our supporter, Viatris. So a huge thank you to them. All right, so diving in head first, so bad habits. I absolutely love this topic because so often the bad habits that are really common in MS are things that you're not even aware of. So we're going to be covering what are bad habits, why are they bad, and I'm going to offer alternatives because I don't want you leaving this call feeling like, well, shoot, I do all these bad habits. Now what? I'm going to give you actual exercises and strategies and things that you can do to hopefully stop doing the bad habits. But my main goal for today is education and to bring awareness around what your habits are, good or bad. Because the first step in making change to anything that we do is just awareness. We need to know that we're doing it in the first place. And I have three main bad habits that I'm going to be talking about today. I would love it if you could put in the chat, and I'll prompt you with when to do so. I'd love it if you could let me know if you do that or not. 95% of the time when I am watching someone and I realize they're doing a bad habit and I'll say, so-and-so, you're doing this, did you know that? Their answer is no. So let's bring awareness to what these are so that you then know you're doing them and can start implementing the alternatives. Okay, so what are bad habits? Just like generally speaking, bad habits are typically things that you're doing with poor form, or they're things that you're doing to compensate for weakness or poor balance or tight muscles. And more often than not, as I mentioned, we don't realize that we're doing them. And that's when it becomes dangerous because more often than not, these bad habits can result when you do them over and over and over again. They can result in your muscles becoming even weaker, or they can lead to tripping and falling. And so again, it's just so important that you're aware on if you're doing any of these so that we can nip them in the bud. I also see Veronica says hi from Texas, Kanita from California, Brenda from Arizona. Awesome. All right. So why are they bad? So we're going to get into the three specifics, but the reason that they're bad is because it's not just a bad habit, it's something that you're training your brain to do. With every repetition, with every time that you do this bad habit, you are teaching your brain that this is a good thing. Our brain thinks that whatever we continue doing is a good thing. That's why it's so hard to break habits that we don't want anymore, because we've trained our brain to keep doing them. So neuroplasticity is when our brain creates and strengthens the movements that we repeat over and over again, regardless of if they're good quality or bad quality, a movement that we want or a movement that we don't want. Neuroplasticity doesn't know the difference. It just knows, oh, Gretchen keeps doing this movement over and over again. All right, let's strengthen that neural pathway, or let's form a neural pathway to get that even stronger. And when it's bad habits, that's not ideal. It's going to be even harder to break them. But the good news is that even if you've been doing these bad habits that we're about to dive into for 20, 30 years, there are still strategies that you can implement to improve them. So these are the 3 that we're going to review. And if you are participating in the chat, let me know which of these 3 that you think you might be doing, or if you're not doing any of them. But we're going to go into each one. So the first one is putting a lot of weight through your mobility aid, or just slouching with your mobility aid. And what I mean by a lot of weight is more than half your body weight, so 50% or more of your body weight. Let me know in the chat if you're doing that. The second one is touching walls or furniture or other people, humans, while we're walking. And then the third is using your arms to lift your leg, one leg or both legs. Specific situations where you might use your arms to lift your leg might be getting in or out of the car. If you're sitting down, but you need to adjust your positioning, you might reach down and lift your leg, getting in and out of bed, the shower, etc. I see a question in the chat that is asking what exercises can I do to lift my leg with drop foot. That is something that we have in one of our other webinars. Since that's not the main topic today, I'm going to keep continuing on with this topic, but we do have another recording of a webinar on that. What can I do instead of picking up my leg with my hand? Yeah, so we're going to get into that. So I see Dion says all 3, Kathy says all 3, Kevin says 2 and 3, plus slouching overall. Yep. Jeff says walls rule. Yes. Brenda, using arm to lift legs. Veronica says putting too much weight through the mobility aid, touching the walls and using the arms to lift your leg. Edna says, I get her on furniture surfing. Yeah, so this number 2, touching walls, is often referred to as wall walking. Furniture is when you touch furniture, it's referred to as furniture walking or furniture surfing. So yes, Edna says furniture surfing. Kanita says I tend to shuffle my feet. Yeah, okay, so let's get into the specifics of these 3. So starting with the first one, putting too much weight through your mobility aid, or slouching with your mobility aid, or for the most part, slouching in general. Now, this is for any mobility aid, and I'm going to demonstrate in a second what it would look like, but why this is bad. The reason this is bad is the same reason that the others are going to be bad, which is putting too much weight through your mobility aid trains your brain that that is normal and that that is required in order for you to walk. And more often than not, if you're newer, or not even newer, how do I want to phrase this? If you are someone who uses a mobility aid like a walker or a cane, trekking poles, etc., more often than not, you probably don't want to become 100% dependent on this mobility aid. At least the majority, if not all of the clients that I work with, that's their goal. They don't want to become dependent on it. Well, if you're putting too much weight, meaning more than half your weight, through the mobility aid, you're training your brain that you need that mobility aid to walk. And therefore, if you don't have that mobility aid or something else to put your body weight through, you're not going to be able to walk either at all or well, and it can result in tripping or falling. And so it's really important to instead strengthen specific muscles and stretch specific muscles. And another one I should have added here that I want to demonstrate is not just strengthening and stretching specific muscles, but also practicing weight shifting. Okay, so I am going to use a cane for this example, but again, keep in mind that everything I say is true for any mobility aid, except a wheelchair, any mobility aid where you're standing. All right, I'm going to back up. So an appropriate amount of weight through your mobility aid is however much you need to use it safely and not any more than that. So more times than not, when you're putting too much weight through your mobility aid, you're really putting weight through your arm. You might even see muscles start to flex because you're putting so much weight through your arm. You might feel a lot of weight or pressure in your palm or your wrist. You might start having elbow injuries, shoulder injuries. Your neck might be really sore because you're putting a lot of weight through it. And often your body's forward or to the side, like this. So that's typically what it would look like. And the typical reasons, plural, are number one, if you're putting a lot of weight through it, or as I mentioned, slouching or hinging like this. One potential cause could be weakness on your backside, weak back muscles, weak glute muscles, weak hamstring muscles, weakness back here. A second potential cause could be tightness here, so tightness in your hip flexors. So we'd want to strengthen your backside so you can stand up and stretch the front. And I'll give you some examples, but stretch the front. If the front remains tight, you're going to stay like this no matter what. If the back remains weak, you're going to stay like this no matter what. So it's often a combination of the two. The third potential reason could be due to poor balance and poor weight shifting. So you're just putting a lot of weight on the cane because you don't have the balance, or the rollator, you don't have the balance to maintain a standing position with less weight through your arm. So let's go through a few examples on what this might look like. So for strengthening your glutes, one of my favorite examples is you could be holding onto a countertop or any sturdy surface with one leg behind you, and you're going to try to lift that leg. Your knee does not need to bend. You're just trying to lift your thigh backwards by using your glute, your butt muscles. You're not seeing any movement in your back. You're not doing this. It's just your leg only going back. And ideally you're seeing or feeling some muscles here working. So I'll show you from this side. So that's what it looks, or from the front. This is what it looks like. And you do the same thing on the other side. If that's too challenging, another great way that you can strengthen your glutes via a seated option is sitting down, feet together and knees together, and you're going to open your knees as wide as you can without letting your feet come apart. And the wider you go, the more you should feel your glute muscles tighten. And then you relax and close. And then open, squeeze, squeeze, squeeze those glutes, relax and close. So those are two of my favorite exercises for that. Now, your hip flexors, those were for strengthening the backside. We also mentioned you want to stretch the front. So one of my favorite stretches for stretching the front, never use a wheeled chair, it's just what I happen to have here, but you could use a countertop, something sturdy, is you're going to put one leg behind you and one leg in front and tuck your butt under. And when you do that, you should feel a stretch in the front of the leg that's behind you. So you should feel a stretch right there. If you don't, keep your butt tucked under while you try to straighten your knee. So you're doing both at the same time, and then you'll feel more of a stretch in the front. And of course, we do this on the other side as well. One leg back, I'll move my hands, tuck your butt under. And if you need to, try to straighten that back knee while keeping the butt tucked. And you'd hang out here, you'd feel that in the front. So that's a way where you can stretch the front. The last cause that we want to touch on is the balance and the weight shifting. So one of my favorite strategies to reduce the putting too much weight through your mobility aid, whether it's a rollator, a cane, whatever, is to practice putting less weight through the mobility aid. So if you normally, I want you to picture a body weight scale, the kind that you'd step on and it tells you how much you weigh. I want you to picture that underneath your cane or underneath your rollator. And think about it in terms of a percentage maybe. So what percentage of your body weight would that scale say based on how much weight you're putting through your upper body? Would it say 100% of your body weight? Would it say 50%, 75? What number would that say? And the goal of this exercise is to get that scale, that imaginary scale, to say a lower number. Now, I'm not saying drastically lower. I'm not saying go from having 75% of your weight through the mobility aid to 10%, but it should be lower. So if you normally put 75% of your weight through your mobility aid, try to put 60% or 65%. Once that improves, you'd back off even more. You try to do 50%, and you're just holding this position, trying to put less weight through the mobility aid and just getting comfortable doing that. Once that becomes a bit easier, you can try to imagine yourself putting less weight through that aid as you're walking. So it's not just balancing, but while you're walking. So those are 3 causes and 3 ways, or a few strategies to reduce those potential causes and help you get out of that bad habit. Examples to strengthen and stretch the muscles. Good, so we did that. Can the use of a walking stick help to correct some of the problems associated with putting too much weight? Okay, I'm really glad that you asked this question. I'm going to repeat it, and others might be thinking this question as well. Can the use of a walking stick help to correct some of the problems associated with putting too much weight on the cane or rollator? This is a great question. Another way that I hear this question when it's asked to me is, can the use of a walking stick or a higher mobility aid, like putting your cane up high or putting the rollator handles up high, will that help with putting too much weight through the mobility aid, or will that fix my posture? And at least in my experience, 95% of the time, the answer is no. That typically doesn't help, at least not for more than a few seconds. And the reason for that is because, let me see. I'm going to grab a trekking pole so I can demonstrate this to you. Okay, so I'm just going to stick with my cane for the example. But again, remember, oh, it's going to fall. Remember, this is true for mobility rollators as well. So if I'm putting too much weight through my mobility aid, through my cane, because I don't have great balance, then, and therefore I can't take my weight off of the mobility aid because I'll feel unstable, then it doesn't matter how high your mobility aid is. Using an aid that's higher doesn't change the fact that balancing here makes you feel unsteady. So more often than not, you'll still, forget the canes here, you'll still be putting the same amount of weight through the cane, or if you put your rollator handles up higher, more likely than not, you'll still be putting a lot of weight through it because it hasn't changed the fact that your balance hasn't changed. It's still not great when you have more weight through your legs. So you have to train your muscles to be able to take on more weight through your legs through that weight shifting exercise. Similarly, the other question that I'm asked is, if I just raised my handles, is that can I walk better? Some people will tell you yes. And for those people that it's worked for, amazing, I'm really, really happy for you. But the majority of the people that I work with, if they were to raise their cane handle up higher, so maybe it's as tall as this, or they raise their rollator handles up higher, they think that they'll go from this posture to this posture just simply because their arms are up higher. And again, Usually that doesn't happen because if your arms are on handles down here, due to, too many aids in my hand, due to tight muscles here and weakness here and down through the back side, then having your arm here doesn't change that you're still really tight here and weak here. So if that's the cause, if the cause is tightness and weakness, then raising your arms isn't really going to change your position. You need those muscles to get stronger and more flexible. What you might find is that you raise the handles and you notice, oh, look, I'm walking better, or standing better, but in 10 seconds, 30 seconds, you're going to start coming back to that same position due to the tightness and weakness. So I hope that makes sense. I use an upright walker. It needs weight on it to push it forward. What can I do? So I'm not exactly sure of the question. It needs weight on it to push it forward. I'm not exactly sure what you mean, so I'll try to answer this. Any walker or any mobility aid, you can put weight through it. That's the whole point, is you should be putting weight through it because that's how it helps you. It helps you preserve and maintain your balance while walking. So the goal isn't to use your mobility aid 0%. The goal is to use it as lightly as you need and no more than that. So number 2 is touching walls or furniture or humans while we're walking. So wall walking, furniture surfing, etc. So why this is bad, it's the same reason as the previous reason. It's bad because it's training your brain that you need to touch something in order to walk, which if that's true, if you're hearing me say that and you're thinking, well, yeah, I do need to touch something, then you should instead be using mobility aid and utilize all those strategies that we just talked about previously. But if you don't actually need something, then by touching something, even if it's lightly, and more often than not, when you are wall walking or furniture walking, it is lightly. You're just touching it just so you know it's there. However, when you do that, you're not only training your brain that you need that thing to be there. So if you ever find yourself in the middle of a room with nothing nearby, your brain is going to freeze and think, whoa, I can't do this. I need something. It's going to freak out because you're not normally in that position. Your brain has been trained that you need to be touching something like a wall or furniture or a person in order to walk well. And we don't want your brain to have that association. So instead, you can practice walking close to a wall, but not touching it, and I'll demonstrate, and progress from there. So often, my clients will say, I can walk fine at home, but as soon as I'm out, like out in public or in the middle of the grocery store, my body freaks out. I can't do it. And part of that is physical. Part of that is that you don't have the appropriate balance yet to walk in those scenarios without feeling safe. But then another part of it is mental. If you are always touching something, then you are literally training your brain to need that thing. And so when you don't have something, your brain is going to freak out mentally. And when your brain freaks out, your body follows suit. So my favorite strategy is walking close to a wall, but not touching it, and then progressing from there. So I'm going to demonstrate. Okay, so if you're someone who normally wall walks or furniture surfs and you're putting a lot of weight through furniture, one of the best strategies that I like to give is to stand close enough to the wall where you can use it if you need to. You can lightly touch, or you could do this if this was a sofa, you could touch the sofa. Stand close enough where you could touch it if you needed to, but practice not touching it or lightly touching it. So if you normally are heavily touching the walls, practice lightly, just fingerprints only as you're walking. So it's there, you're lightly touching it. and you're practicing not putting a lot of weight through your hands. Once that feels more comfortable, then progress to not touching at all, but hovering. So it's you're near the wall, but hover. So if you feel off balance, it's right there. You can still touch it, but practice not touching unless you need to. Once that feels more comfortable, and that might take weeks or months, but once that feels more comfortable, then practice taking a step away, just a small step. So it's still there if you need it, but you're not as close to the wall. And you can still have your hand out if you need to, but you're going to practice walking without touching. If you need to, if you lose your balance and you need to touch, go for it. Otherwise, don't touch. Once that becomes more comfortable, guess what? Another step away. Now this might be a little too far away, so you should feel very confident by the time you get here that you don't need that, because you don't want to reach for something that's out of reach, and then you could fall towards it. So it's away from you, and you practice walking here. You could use a mobility aid as well. Once that feels comfortable, you practice walking here and then here, to the point where eventually you're walking in the middle of the room, because you've now trained your muscles to have the appropriate strength and balance to do that, but you're also training your brain that you don't require the need to touch something when you're walking. So again, it's a physical and a mental thing. And another reason that this can be a dangerous habit is because it's typically fine when you're in the comfort of your own home and you know exactly where things are and how far they are from other things. Like, you know where your couch is in relation to the wall. But it gets into tricky territory when you're not in your home. If you're at the doctor's office and you think, oh, I see that wall, I'm just going to touch it, but it was slightly further away than you thought, if your depth perception was off, that's not great. That can result in a trip or a fall. Or if you're at a friend's house or you're a relative's house and you see a table and you're like, oh, I'm going to put my hand on that, I need that for balance, and you didn't realize it was on wheels and it floats away from you and you fall. It becomes a really bad and scary habit in those situations. And so it's best to train yourself at home and out in the community to not utilize walls, furniture, or humans. And again, if you need to, you should be using a mobility aid instead. Any questions, comments, thoughts on that before we move on to the last one? I don't see any yet. But one last thing I want to say about that, as I touched on, that might take a while. I just mentioned that progression pretty quickly. Each of those levels might take weeks or months. So we're looking at the long game here. We're not looking to make that entire progression within 30 days. It takes a while. And the longer you've been using furniture or walls, the longer it's going to take, typically, for you to progress through those variations. So this is the last one. So using your arms, and a bunch of you said that you do this. So using your arms to lift your legs. So often you don't realize how frequently you're doing this, but just the fact that a bunch of you said that you do this is great. That's great awareness. Awareness is the first step. My next question for anyone who said, yes, I know that I do this, would be, when are you doing it? Is it when you're getting in and out of the car? Is it when you're getting in and out of bed? Is it any time you need to shimmy around and change your position while sitting? Is it getting dressed? When is it? Because that'll help you out with the exercise piece of this. But why it's bad is because when you use your arms, we might think that we're doing something good for our body, because since our legs are weak, we can reach down and lift our leg with our arms, and then we can do the movement, which is great. But the harm in that is when you do that, when you just resort to using your arms instead, you're not even giving your neural pathways and your muscles the opportunity to get stronger in that specific situation. So you end up getting weaker and weaker, which is why the most typical response is that people do this when getting in and out of the car. They'll just reach down for their leg, lift it up, put it in the car, or lift it up, get it out of the car. But when you're doing that, your hip flexors, which are the muscles you need to lift your leg, they're not working at all. And so not only is that muscle getting weaker, but in that specific situation, your brain doesn't even turn on. If we had an MRI machine hooked up to your head, anytime you go to lift your leg, there would be a part of your brain that lights up saying activity, muscle awareness, muscle activation. But when you're in that specific situation of getting in and out of the car, your brain wouldn't light up all. Nothing's happening with your hip flexors because your arms are doing it all for you. So your hip flexors are going to get weaker and weaker in general, but also your brain doesn't know to use your hip flexors in that situation of getting in and out of the car. So let's demonstrate what that's going to be. And I see people say getting dressed, getting in and out of the car. Yeah. Let's pretend this is the passenger seat, we'll say. So I'm in the passenger seat of a car. If you're in the US, then for me to get out of the car would be to go to this way, to go to my right side. So I'm in the passenger seat on the right side of the car. So if I'm going to get out of the car and I'm using my arms to lift my leg, or if I'm getting in the car and I'm using my arms to lift my leg, again, that's not helping out our muscles. It's not helping out our brain, our neural pathways. So if I'm trying to get out of the car, here's what you need to do. Practice using your hip flexors, even if you know for certain that your hip flexors, that your leg is not going to lift. Even if you know that, still practice it. And I have a rule coming up that I'll share with you in, I think, one slide. But so if I'm trying to get out of the car, I'm still going to try, I'm sitting in the car, I'm going to try to lift my leg and then lower it and lift. And you're practicing this marching exercise as an exercise, this marching movement to lift and down. If you can, try to practice the exercise to lift and go out, lift and come in, even if it's a mild lift. We're not looking for big movement here, but what can you do? Can you lift and move it at all? Lift and in. What that does is it allows your hip flexors to work, and even if they're not working, even if you go to lift your leg and nothing happens, at the very least what's happening is your brain, if we had that MRI machine on your head while you're doing this in your car, your brain would light up knowing that there's effort being put in, like there's someone attempting to lift this muscle while I'm in the car. And your brain can start to associate the two, that I should use my hip flexors when I'm in the car to get in and out of the car. And so attempt to lift when you're sitting in the car. If you're on the outside of the car and you have to lift to get in, attempt to lift your leg using your muscles without just resorting to lifting. Now I do have a rule, I'll share it twice. If it doesn't work and you need to go somewhere, you can use your arms after you've tried, but the idea here is at least try first. Try to lift your leg before just resorting to using your arms, regardless of if you're in the car, if you're getting dressed. And any time that you use it, try to use those hip flexors first. That is one of the best ways, again, to not just physically see an improvement, but mentally as well. So much of bad habits and habits in general are mental too. We've associated patterns in our brain, and so these habits keep happening because of our brain thinking that we need to. So we need to stop that. Okay, so this is my rule of two, because especially with that last one, or really with any of these bad habits, if any of these tips feel too hard, if you're trying your best to not put weight through the wall or the furniture, or you're trying to not put too much weight through the rollator, but it's just too hard and you can't do it, and it prevents you from doing the thing that you're trying to do. It prevents you from getting in the car. It prevents you from getting to the bathroom because you're trying to walk well. Then implement the rule of two, which is try to do the right strategy twice. If it doesn't work, or if you're not getting to where you need to go, then you can just stop and do what you got to do. So if you're trying to get in the car, but you're not using your arms, try twice to not use your arms. If it still didn't work, great, go ahead and use your arms. If you're trying to put less weight through the rollator or the cane as you're walking forward, try to take a step or two with putting less weight through that rollator or mobility aid. If it's not going well, if you still feel like this is too hard and I've got to go to the bathroom right now, you try a few steps. If you realize it's too hard, great, go back to just do what you got to do to get to the bathroom. So you're going to try twice. If it doesn't work, do what you got to do. At the very least, what this is doing, well, two things. One, it is giving your physical body opportunity to use those muscles to practice that balance. But number two, it's telling your brain, it turns your brain on in those specific situations. Like, hey, brain, I want to use my balance when I'm in this situation, or I want to use my hip flexors or my leg strength or whatever it is in this situation. So it's doing two things. That's good for your physical body, but also your mental body and the connection between the two. Okay, so that's what I've got for you today. As always, if you need to reach out or need any other resources to help, here's my email, my website, if you're interested in working with me, my podcast, my YouTube, my book. I've got so many other resources as well, but these are some of the main ones. And I'll stop and answer questions too. You said to keep feet flat when moving knees apart, but my ankles won't bend that way. How can I best improve ankle flexibility? So yeah, let me demonstrate that again. So this was for the seated clamshell. So let me get back so you can see my feet. All right, so your feet stay together and your knees open as wide as you can. Everyone's gonna have a different level of hip mobility. I don't have much mobility in my hips, so this is as far as I can go. You might be able to go much further without your ankles rolling, or maybe less. You might only be able to go here, and that's fine. But the goal is keep your feet, keep your ankle bones touching, the instep of your feet touching, because as soon as you let them roll apart, you're no longer really using your glutes anymore. But if you can keep them together, you'll use your glutes. So this exercise is not at all about ankle mobility. In fact, if the less ankle mobility you have, it might actually make it easier to use your glutes instead of using your ankles to make it look like you're going far, but you're only going far because of your ankle mobility, not because of your glute strength. Thank you so much, Dr. Gretchen. You're welcome. My left leg drags. How do I regain mobility? So left leg drag, or any leg dragging, can be caused from so many different things. And so to regain mobility, it would be best to work with an in-person physical therapist that could watch you walk and analyze not only what is happening and why is this happening, but also prioritize, because likely there's more than one reason. And sure, you could do a ton of exercises for all those reasons, but that might be a lot of exercises that's unrealistic for you to maintain. And so your physical therapist can establish what are those reasons and which ones do we need to work on first that might have the biggest impact before we start working on the others. Just to give you a very brief idea of what might cause that. So leg dragging could be caused due to weak hamstrings. It could be caused due to foot drop. It could be due to weak hip flexor muscles. It could be due to spastic or tight quad muscles. Pain anywhere, hip pain can cause that. It could be due to poor balance on the right side. So there's lots of things that could cause that. Thank you for this webinar. Rhonda in Waterloo. Rhonda's my neighbor, kind of. We're like an hour away from each other. You're welcome. When standing, I feel I am being pushed on my toes when walking. What can I do to help with that? So that is a weight shifting, I don't want to use the word exercise. It's a weight shifting issue. Like your body feels and your body probably is, putting a lot of weight through your toes. So one of my favorite exercises, it sounds simple, but it's not easy, is using a mobility aid or a sturdy surface, practice putting more weight through your heels. And this is the same concept that we talked about with the first one, where if you're putting too much weight through your mobility aid, so if you normally are putting a lot of weight through your toes, practice putting more weight through your heels, putting weight on your heels. If that's too challenging, then you might have limited ankle mobility or really tight calf muscles, so maybe stretching your calf. Again, if that exercise of shifting more weight to your heels is way too hard, see an in-person physical therapist who can help you determine why and what to do about that. My husband wants me to walk hanging onto his arm, not hand, because I walk faster. How can I help him to see that it is okay if I am slower? I practice walking at the mall and he can take me there since I can no longer drive. So I think this might actually be more of a conversation to have with your significant other or whoever in other people's situations, whoever it is that wants you to do something because it's faster. First and foremost, think, does it actually need to be done faster? Are you late to an appointment and you need to get there? Or like, is there a situation where you do need to go fast? If so, then maybe those are the situations where you do the thing that allows you to go faster. But if there's not that need to move faster, then having that conversation with that person on why you want to go slower, that slower is better to strengthen your muscles, or holding your hand in a different spot allows you to not depend on that person as much, so that you're using your own muscles. It's going to be better and better for your muscles and better to get stronger muscles by doing that. So having that conversation and also letting them know that not only is it good for your body, but maybe you want to go slower so that you can work on these things, so that you can work on strength and balance. So I feel like that's more of a communication answer, if you will. I have neuropathy in my feet, so I can't feel to see where my weight is. Yes, that is a great point. We actually have a whole webinar that we've done about sensation. What you could try to do, there's different brainstorming things, is like if you do have a body weight scale, put it under your toes and physically look at the scale and see how much weight am I putting through my toes. Is it a lot? If so, like if it says, I don't know, 20 pounds is through your toes, try to get this scale to say 15 pounds. So you can actually get like a numerical number for that. Or maybe your feet might feel the ground better if you have a different texture under your foot. So there's a company that I like called Naboso. I'll spell it out for you. It's Naboso. They have, do I have anything? Actually, I do. So they have a ton of products. This is their standing mat, but they have a ton of products, including shoe inserts. Can you see? Okay, can you kind of see how there's pyramids on here? It's not just a flat mat. So it's kind of, I like to think of it as like braille for your feet, in that it feels raised. It feels like there's a little pointy surface under your feet. Having your bare foot on here might allow you to feel the ground more. And so maybe you do your exercises on there so you can feel your feet better, and therefore you'll know where they are in space. This has been really eye-opening for me. Thank you so much, Dr. Gretchen. Good, I'm so glad. And again, the exercises and strategies and things that we've been talking about in each of the different examples, the number one thing is that you just become aware of, am I doing this? Because if you're not aware, if when I asked you in the very beginning, do you do any of these things? And you're thinking, I don't know. The first step is pay attention. Now that you know what these things are and you have specific examples, throughout the rest of the day today or tomorrow, throughout this week, just be thinking, did I touch walls today? Did I touch furniture? Am I putting too much weight through my mobility aid? Awareness is the first step. Then once you know you do it, then you can implement some of the strategies that we discussed. Awesome. All right. Well, if there's no other questions, comments, thoughts, oh, let me see. Any new therapy discovery? Yes. So I actually have a podcast. I've been sharing on my podcast and on my Instagram page new therapies that are in clinical trial that are really exciting. I also think this might be a topic that we have coming up in 2025 as one of our webinars that we have. So stay tuned for those. My podcast is called The Missing Link, the MSING link, spelled like that, if you can read that. So you can check that out as well. But yeah, there's I won't get too far into it now, but there's several in clinical studies right now that are seeing positive results so far for remyelination, which is very exciting. I have trouble standing. Yeah, so standing, a great exercise for that is practice standing. We need, as we all know, we need to be able to stand in order to walk. So if walking is too tricky right now, practice standing as an exercise and practice being able to stand with even weight through both feet if possible. So 50% through your right leg, 50% through your left leg. And let's really take it down to the basics and start there. And then work on more walking based exercises. But there's lots of seated exercises that you can do to help with standing, to help with walking. There's just simply standing as an exercise. So try not to feel, I know it's easier said than done, but just because you can't stand doesn't mean you can't exercise. I've noticed that there aren't a lot of trials for PPMS. Correct, there are not, but there are more trials with progressive MS, specifically non-relapsing secondary progressive MS. But I have a feeling that if these clinical trials in non-relapsing secondary progressive MS are helpful, then they would also be helpful for primary progressive MS. Mandy's asking, are you speaking of Pipe 307? Yes, so Pipe 307, ABA 101, NVG 291, all of these are ones currently in clinical trial that I think are worth keeping an eye out for. I currently feel positive about them. I don't have any reason not to at this time. What else was I going to say? Oh, there's also like for disease modifying therapies, there's CAR T cell therapy. So we'll have a whole discussion on it. But yeah, it's an exciting time for medications because there's different processes for these medications compared to what's currently available. Timing the standing gives a range of something to shoot for to increase 60 seconds one day, 90 seconds the next, etc. Yes, that's a great idea, Lori. And honestly, I've worked with some patients where we start at 10 seconds. Can you stand with any quality for 10 seconds? If so, can you do 20 seconds or 15 or then 30? So giving yourself a time is a great idea. And then once you feel you're getting better at that, maybe then you focus on good quality, like standing posture versus just standing in general. Is back supporters help walking and pain at all? I'm not sure about that. I'd have to look into that. How to walk outside of the home is the way to feel comfortable. Just practice any other suggestions. Yeah. Once you, so you know that exercise we were talking about where you're against the wall and you slowly move further and further away. Once you feel comfortable with that, the next step is walking outside, not around anything that you could touch, like the sidewalk, or making it harder, adding uneven surfaces like the grass. But practicing real life situations needs to be part of the plan. That implementing it into real life situations is always going to be something that can help you feel the benefits versus just being able to do it, but only in your home. You have a positive outlook as I start one of the trials tomorrow. Oh, awesome. Cool, Mandy. Well, Mandy, hopefully you can join us in 2025 when we do have that one. I feel like it might be January or February, and you can let us know how your trial is going. Love the standing idea. Thank you. You're welcome. Back support braces. Braces in general, how do I phrase this? Braces can be helpful when used in addition to strengthening and stretching exercises. For example, if you're having back pain due to weakness in certain muscles and tightness in other muscles, then wearing a brace isn't going to change the fact that you have weakness and tightness. So you might feel better with the brace on, hopefully, which is great, but as soon as you take the brace off, you still have pain because you didn't change the cause of the pain. So I think I personally like braces when they're implemented with the appropriate exercises. I would never recommend someone use a brace and like not give them exercises to help with that too, because it's not a long-term fix. I carry my trekking poles to practice walking outside in case I need them. Yeah, that's perfect. Especially if, again, with the exercise of touching the wall and moving yourself further away, when you do that outside, it's going to likely feel even scarier. So maybe you do want to have trekking poles with you or a cane with you or a person nearby in case you do need them. You have something there for safety. Awesome. Well, this has been such a great discussion. Thank you to everyone for tuning in and participating in the chat. I always love when I can see what your comments and thoughts are, because I can tweak my exercises and my guidance based on what you're personally going through. So thank you for participating. I will see you guys next month. Oh, an easy way to remember of when to meet us is the second Monday of every month. So that happens to be December 9th next time. And again, a huge thank you to MS Views and News and our supporter Viatris. And our topic for next month is posture and core. All right, have a good night, everyone. Thanks for tuning in.